Revival. 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 I think you can do much better than that. Revival. 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 Amen. The stage is still a bit empty, so I'm waiting for someone to join me. Give it up for Dignes Priscilla. And like our dear Pastor Waterbury already said, we are in the week of health awareness. And today we're just going to do a recap of Friday for those who were not present, those who missed out Friday. You missed a very healthy, organic, spontaneous discussion. Me, myself, I was surprised. I was surprised how much interest there was in that theme. And we're going to talk about sickle cell. And I would like to kindly ask our deaconess to kick off with a presentation.
Thank you. Next slide, please. So these are the points we are going to talk about. The first one is, what is sickle cell? The cause, what triggers sickle cell, treatment of sickle cell, the misconception, and daarna, if you have questions, we will answer. Next slide.
So what is sickle cell? To be honest, it is something that a lot of people are unaware of, something that is a disease, a disorder, but there is very few knowledge among the people about this, but there is a lot of knowledge out there. So it is basically our responsibility to invest in ourselves to know what is sickle cell. So most important thing is sickle cell is a disorder. Amen? Sickle cell is a disorder, and it basically it is a disorder that is genetic. I said what? It is a disorder that is genetic. It means that you don't have to do anything specific. You don't have to do any effort, any thing particular to get this disorder. It is basically already embedded into your DNA. So it doesn't matter if someone, it is not like a virus or other kind of sickness like the flu or a COVID-19, that where someone sneezes on you or you're not carefully washing your hands properly, you will get it or you will be contaminated. Rather, it is what I said, embedded into your DNA, into your genetics. So it means that when you are born, you are already a carrier, possibly. Amen? Are we together, church? Are we together? So it is also important to know that sickle cell mainly targets the red blood cells in your body. The red blood cells are the victim of this sickle cell disorder. And I'm going to, like you know, your Pastor Joel is also a person that always likes to give practical examples. So you see these two red blood cells, and they are both blood cells. So the left one on top and the right one, they are both blood cells, red blood cells, but they have a different shape. So let's start about the shape. The left one has a good or a healthy form. I said it has a good and a healthy form. And this one, the left one, the healthy one, is with the current form it has, it can easily go through the blood vessel. And what is the blood vessel? The blood vessel basically is the tunnel that exists inside your body. So inside your body, there are a lot of tunnels that transport. Like the highways in our country, they facilitate transport. They facilitate logistic. So blood vessels in your body, they are basically tunnels which are for transportation of oxygen. They give oxygen to the different parts and organs in your body. And the left one, like I said, the form it has is a good form. It's a healthy form. So they can flow easily without causing any problem or complication. But then on the right one, we have a red blood cell that has been affected by sickle cell disorder. You immediately see that there is a difference in the shape. It has a difference in the shape, and it looks like a C, it looks like a half moon. Some say it looks like a croissant. It's also something I heard. And immediately when you have this form, problems are on the way. I said problems are on the way because with this form, the C form or the half moon, eventually the blood vessel, which is the tunnel, will clog up and will become blocked. And if that blood vessel becomes blocked, if your tunnel becomes blocked, it means that oxygen cannot travel to different parts of your body. And when oxygen cannot travel to different parts of your body, you can say that organs are starting to lack oxygen. You can take your liver, for example. You can take your heart. You can take your lungs. You can take your kidney. They all now have something that is called oxygen deprivation. I said oxygen deprivation. So immediately when you have oxygen deprivation in one of your organs, you are almost a selected candidate to have failures. Amen? You will have failures with time. Are we still together, church? So it is also important to notice that the left one, the average lifespan of a healthy red blood vessel or red blood cell is 120 days. So after those 120 days, it will renew. But the right one, the one that is affected by the sickle cell disorder, is only 30 days. So you can see a proportionate amount of difference in the lifespan of these two. And while I'm at it, I'm also going to... no, actually, let me pass it on to our sisters, okay, so you can continue. Yes, please.
Next slide. So what's the cause of sickle cell? Now, basically, sickle cell is genetic. So if two genes are inherited, so one from the mother, one from the father, the child you will get will either be a carrier of sickle cell, and that means that it will not have symptoms of the disease. And it can also be possible that the child will have the disease.
Maybe if we can zoom in for the people so you can see the overview, the scheme. Because it can also be that in a family, one of the children can have it and the other one not, right?
That's true. Kan je inzoomen?
It's not possible. It's okay, it's no problem.
No problem. All right.
But basically, to explain it, there is something like how can say? You can say it's like an overview to determine or make a forecast of the probability if someone will get the sickle cell or not. And something that is very important is there are two types of sickle cell labels, you can say. You have one that is called the sickle cell trait, and the other one, Priscilla?
Sickle cell anemia.
And which one is worse?
The sickle cell anemia. That means you have the disease and you have the symptoms.
So it means that when you have the sickle cell trait, you have it inside of your body, but it is not causing any symptoms, any pain, any trouble. But it is still present in your body. And it also means that you can pass it through to your children, and they are, how do you say, not promoting, but it becomes worse because they can eventually end up with the anemia version.
Yes.
Okay. Something, I think we can go to the next slide.
So what triggers the sickle cell crisis? Sudden change in temperature, excessive exercise, dehydration. So that means you have to drink a lot of water. Infections, stress, swimming, smoking, and other medical conditions, so as diabetes.
Thank you. And something I want to add on that. This is what triggers the sickle cell crisis. But if I can just briefly touch on the symptoms, because that was one of the questions on Friday. The symptoms of sickle cell is episodes of extreme pain. Well, like we said on Friday, these are the pain crises. There is an increased risk of serious infections. You can have the anemia, which is basically red blood cells not being able to carry enough oxygen to the different parts of the human body. And eventually this anemia will cause tiredness and shortness of breath. So you will notice that someone is having difficulty breathing. You will see and notice that someone is feeling very tired, and it is not because the person is lazy. Amen? But basically there's an underlying problem going on. Let's go to the next one, please. Treatment of sickle cell. So basically, according to the knowledge, according to today's modern day science, there are two treatments for the sickle cell disorder, which is a bone marrow transplant and a stem cell transplant. And if I start with, well, they are very similar in the sense of the procedure and what it is all about. But one of the biggest differences is the pain level. A BMT, also known as a bone marrow transplant, is very, but very painful. It is one of the most invasive and painful surgeries there are out there, and it is not something people would choose for fun. It is really you being desperate and having the green light from your GP, having the green light from your specialist, that you can end up getting a BMT. And it's basically in the bone marrow. The bone marrow is the, I wouldn't say the oxygen, but you can say maybe the factory of cells that are affected with this sickle cell, in the sense of, in your bone marrow, there's something that is called hemoglobin, which is basically the structure stones, the structure pieces of a red blood cell. And when these cornerstones or these construction stones have a wrong structure, they have a wrong pattern, you are almost certain to have a sickle cell at the end. Amen? So basically, a bone marrow transplant is not an option you can choose just like that. There are some conditions that are attached to it. Like, for example, if Pastor Godfrey would like to donate his bone marrow to me, and I know he would, he is not able to do that. Not because he is not willing, not because it is painful, but simply because he is not eligible. Amen? Are we together? Simply because he is not eligible. And why is he not eligible? Because he is, in the spirit, he is my sibling, he is my brother. But biologically speaking, he is not my brother. And only my biological siblings can provide me with a proper and good bone marrow. Why? If I take bone marrow that is not part of my brother or my sister biologically, there is a chance, or maybe a high chance, that my body will do what? Reject it. My body will not accept this because it is like an alien bone marrow entering my body, and my body is saying, I don't recognize this. This is not ours. So instead of this treatment having any success, it will actually worsen the situation. So only a brother or sister which is eligible can give healthy bone marrow. Also important, there cannot be any underlying problems, any other problems outside of the sickle cell disorder, because the fact that this is such a painful and invasive surgery, if you have more problems that are going on, it can be fatal. You will not be able to handle it. Amen? Also, it is important to notice that during these treatments, like I said, the bone marrow transplant or the stem cell transplant, it is not strange, or better said, it is common that also chemotherapy is present. So next to the fact that you have already this invasive and this scary operation and surgery, there is a possibility they will also give you chemotherapy. There's also a possibility they give you radiation therapy, just to see and try to help you. But they try to help you is actually adding treatments and treatments and treatments, and it is very intensive. It is very intensive, and you really need to think about what is the treatment that is best for me. And I can guarantee you, you cannot continue with your normal day life if you're undergoing one of these treatments. It will definitely have effect on your daily basis life. Amen? On to the next one, please.
Next slide. A misconception about sickle cell. People suffering from the sickle cell disease die young. True or false?
So people suffering from sickle cell disease die young. Actually, it is balanced, 50-50. Yeah, the answer is 50-50, conclusion is 50-50. Why? Because there are people who have died at a very young age due to the fact of sickle cell disorder. But we have also seen a lot of registered cases where people have continued to live a very long and happy life with the sickle cell disorder. So it is not significantly shortening people's lives. So it is not enough to establish that thesis that sickle cell patients are dying at a young age.
Yeah, thank you. There's no cure for sickle cell disease. True or false?
Well, in this case, false, because we do have treatments. Yeah. To be honest, up till a couple of years, I'm not quite sure how many years exactly, we only had one treatment. So now we have the knowledge, the science, and we're fortunate enough to live in a country where the medical resources and the medical availabilities to our disposal are very advanced. So now a second treatment has been added, and I wouldn't be surprised if a couple of years, a third or fourth or even a fifth one would be added. So yes, there are treatments for sickle cell.
Yeah. Next slide.
I think the next slide was with the round. The next slide was basically on for those who are present on the Friday. We had you could say a panel where people spoke who had a sickle cell, so sickle cell patient, and experienced their they shared their experience, shared what we can do best in case they get a pain attack, share how their daily life is affected, share how basically a normal day for you is very different than a normal day for them. There are certain things they avoid or they don't do, but at the other side, we also learn that everything you and I eat, they also eat. Yes? So this was our brief recap on sickle cell. After the service, I want to invite you because we'll have a free health check. In the morning, we had plenty of people coming by and getting their checks. So we are based on the first floor at the children's department. So come and get your free health check and don't miss out the opportunity. Amen?
Amen.
And this was basically Pentecost Revival Medical Team. Yours truly. Your favorite medical team in the city.
Oh yeah.
I'm not sure if there are any questions.
If there are any questions.
In the audience. Yes, there is one. Or maybe even upstairs, to also have a microphone upstairs, just in case.
Thank you. Thank you for that knowledge.
Yes.
I just wanted to ask a question around BMT. In regards to the fact that you need siblings to donate. If you do not have a sibling, what happens in that scenario?
That's a very good question.
Is it like close family members could potentially donate too? Thank you.
Yes, thank you for your question. Let me have one microphone to my chief overseer, Dignes Yolanda, as well. Because where I will fill with the knowledge, she will complement. Give it up for Dignes Yolanda, also part of the medical team.
Revival, revival, revival. First of all, thank you for being here. Thank you for participating in the discussion. We started off Friday already, and the feedback we had was very good. So thank you, and we're grateful for that. Your question about the bone marrow transplant. It has to be a sibling, and if you don't have a sibling, then you're not eligible, because you have to have the same, not DNA, because everybody has different DNAs, but you have to have the same cells. So same mom and dad, and if it's not the same, then you can't transplant. So my cousin or my auntie or my uncle can be a donor, basically, because we don't have the same, it's not the same as my sibling who has the same mom and dad.
Maybe someone will have the second question, because I'm already hearing it in my mind. What about half brothers and half sisters? So we might have the same dad, but a different mom, or we have the same mom, but a different dad.
Then you don't have the same mom, or you don't have the same dad. You really have to have the same mom and
Both.
the same dad. Yeah.
Both biological
Both,
parents.
yeah, echt both.
Thank you for the knowledge. There's a question over there on top, second row.
So, I would like to know, how can you prevent having a child that has sickle cell?
It's a very good question as well. I like that you said the word prevent, because there's actually most thing you can do is it's up to the parents. In this case, they are the ones that can do the most, in the sense of basically asking your partner, basically asking the one you're with about their medical history. You can even, for example, don't even know that you have sickle cell or the trait or the anemia. Then the first step would be, of course, to find out. How do you find out? How do you find out?
Waar?
How do you find out if you have sickle cell or not?
How do you find out? By checking your blood.
Thank you. And then someone, because I really had this question this morning, someone came to me and asked, can I get my blood tested with you? I said, no, unfortunately, we don't have the capacity. You see? We don't have the capacity because why? The blood must be researched in a laboratory. But maybe in the future, we will have laboratories to our disposal. Yes. Yes. You see, I know what my colleagues like. So yes. We will have medical laboratories as well. But yes, jokes aside, it is up to the parents to then, for example, establish if you have it or not. Maybe you don't have it at all. And if you have it, which form, which label? Do you have the trait or do you have anemia?
Yeah, I wanted to talk about the trait and the disease. You have the trait, so you have the sickle cell gene or you have the sickle cell in your blood, but it's not active. So it depends. Maybe you have the trait, but you don't have the disease. But if you have a trait, it doesn't necessarily say that you will be sick or you have the disease. So it's very important to communicate with your partner if one of you have the trait. Because if you both have the trait, then it's possible that your child would have the disease as well.
So if I understand correctly, the trait can develop into the anemia version.
Yeah, if both of the parents have it.
The trait.
So you both have to have the trait. If you have the picture, can we go back to the dia?
Yeah,
Because it's very simple, actually.
It is the slide with
The cell.
cos.
The blue and the red.
Yeah. The one after this, I think. Yes, the cos.
Yeah. So you can see the parents. So you have male and you have female. They both have the trait. So let's say blue is without the sickle cell and red is the sickle cell. If you have a child with blue, the child doesn't have sickle cell. If you have blue and red, like the parents, they have the trait, so they have the cell, but they don't have the disease. But if you have a red, then you have the sickle cell disease.
Which is the worst version.
Yeah, then you have the disease.
Okay. Follow-up question. Oh, I'm sorry, Papa. I didn't know.
Yeah, in terms of treatment, you give two alternatives: the bone marrow transplantation, and then the stem cell. Could you give us an idea as to what the stem cell
Transplant.
What is really the treatment? Could you explain to us the stem cell
Treatment.
Yeah.
Okay. So I explained a bit about the bone marrow transplant. The stem cell transplant is basically, in both cases, it's a case of extraction and insertion. That is the most important. Even with stem cells, with a stem cell procedure, the stem cells you have at the moment from someone who has the sickle cell disorder will be extracted, and someone who has, how do you say, healthy stem cells, which are eligible, will also be extracted and then inserted in you. But the difference is that for a BMT, it will be extracted from the bone marrow that is in the back spine, a very sensitive place which will cause a lot of pain. So that's also why a lot of people prefer to choose the stem cell transplant rather than the bone marrow transplant?
The stem cell transplant is basically a blood transfusion. So Friday, our sister Nira, she's also in the medical team, shared her experience about donating blood. It's basically getting blood. It's just blood transfusion, so blood transfusion. So it's basically changing or getting new blood. Basically, simple said.
Yes, my question was actually based on the information that you gave. So would you actually advise people that before getting married or before having children to go and check if they are compatible when it comes to blood?
To give blood or if they have the trait?
So
If
do you advise them to go and check before even getting married or start with children so that they know
Yeah.
if it is advisable to?
I would. It's really good to know if you have it or not, because yeah, it's your own decision if you choose to still marry the person. We have a lot of treatment, so it doesn't have to be something to not marry the person. But I definitely would, so that you know where you could what you can keep in mind for having a child with the sickle cell disease.
Mommy Sheila.
Yeah, and throughout since Friday, all that we heard, all that we saying, the shortest thing to do that our children will be saved, just like the gentleman said opposite. It's very important that today, whatever we've heard, we should keep it, because our children is the one who's going to do what? Suffer at the long run. When you have a fiancé or spouse, make sure you check. Don't be shy, because people make trouble. Oh, do you know that you don't believe me? Do you know that you think I have disease? It's nothing. You just, for the safer side, please, today, let it be in the back of our mind that when you have a man or a girl, you just go to the hospital, they take your blood and check all kind of diseases. Because at the end, your children will suffer. And you yourself, you will not sleep. So please, from today, all the young
Thank you, Mommy.
Yeah.
Yes.
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 So all the young people, don't feel shy. Go and check whether AIDS, whether diabetes, whether by blood pressure. You know your status. And then at the end, you'll be happy.
Thank you, Mommy. Thank you. Thank you for creating more awareness.
Yeah.
Yes.
And what she said, it doesn't have to be the sickle cell. Not only sickle cell you have to check. You can ask STD, hepatitis. Go and check and inform each other, because it's good to know if you don't.
We have another question. Yes.
Ik had een vraag. Want Nira, toen zij vrijdag aan het praten was, toen zei ze dat ze op haar 4e of 5e last kreeg van symptomen. Maar er is ook een ander verhaal gekomen waar iemand pas op de geboorte, zeg maar, last kreeg van de symptomen. Dus hoe zit dat eigenlijk?
Development of symptoms.
Ja.
Ja, ik denk dat, well, it is very personal because obviously everybody is different. So it might has to do with underlying problems, for example, things that are other genetical disorders and diseases that have been passed on to the child that can cause someone to have a later discovery of symptoms, and for other children it'd be right at the birth. Because if I'm not mistaken, in the case of Nira, the parents knew about it before she was born, but Nira herself, the patient, discovered it at a later age. In this case, I think it was in 1st grade or kindergarten or something like that. So per person it can be different. Some other children will receive it maybe or experience it like 6, 7 years old. It is very personal and everybody is different. Yeah. Are there any more questions?
Sorry.
Yes, sorry.
Me again.
No, it's okay. It's okay.
I have 2 questions. With the sickle cell treatment, even if it's successful, is there a chance that sickle cell can develop again? And my next question, what is the success rate of the treatments themselves?
I checked. I promise you I would check on that. According to the data I have been able to collect, the success rate is 78%. 78%. And 5% did not make it. So the 3 years after the treatment, 5% of all the people that took the treatment did not make it as a result of the disorder. But in general, the data is 78%. I have not encountered, while I was reading the papers and studies about anyone having the stem cell and then recover or get better and then go back into it. So it is something like a permanent shift. So you get better and then from there on you move. But again, the data is 78%. 5% of all those people in 3 years' time after the treatment, they will come to pass on.
Okay. Reviver.
No.
I think the good advice, before you marry, you must check. Because sickle cells is very dangerous thing. Sometimes the man is AA. The woman is AS. I don't know the way you people speak the English here, but Nigeria, yes, SS. If the man is AA, the woman is SS, maybe he can take AS. But if the man is AS, the woman is AS, the one of the children can take SS. That is very dangerous. I will speak good the English, let everybody understand. To have SS is very dangerous because that children, you mother, you can stay to 30 years before the baby or the youth, the boy can stand or the woman. That I think that's simple. Before you marry, I don't know Europe here, but Nigeria or Ghana, before you marry, you must check before marriage. Thank you.
Thank you, Mom.
Thank you. The AS and the SS is commonly used in Africa. The SS is sickle cell, so you have the sickle cell disease. Fortunately, we have a very good healthcare in the Netherlands. Our sister Nira also told us she got followed regularly till the age of 18, and from 18 ongoing, it was her own responsibility. But we're very, very, very fortunate with a very good healthcare here in the Netherlands. So they follow up on the children. So that's good to know. In Africa, it's different, but here it's being treated very well. No, if you, depends on your doctor as well, and yeah.
But I want to put emphasis on something.
Not okay, not
want to
always.
say
Yeah, not
You
always.
know something, eh?
Yeah.
After I have 3 friends here. You know something, Santa Cassifoni, the medicine.
Cholecalciferol.
Yes.
For the
Sometimes
bones.
it doesn't because the children, he have some food they're supposed to eat.
Yeah.
But you can help them for home. But immediately they go out, they will eat oil thing. Then if you are SS, you start eating oil. Like this potato.
Capsalon, see.
Chicken. This and that. You know, you can control your child for home. But if you reach outside, you eat that thing, sickle cells is not easy to control. Europe here, I have to, every month, you must live for AMC there. Every month. Only if you reach 30 years before, you can strong small. But the sickle cells is dangerous. I advise, please, let them check before marriage.
Thank you. I want to put emphasis on something. As the Pentecost Revival medical team, it is important to know. Are we still together, church? It is important for me to emphasize this point that we are here to give information. Beyond that is out of our jurisdiction. We are not advising anything. We are not a marriage counseling agency. We are just providing the information. It is wise to check, but what you do with that information is up to you, God, and your partner. Amen? That is just the point I wanted to emphasize. I'm not sure if there are any other questions.
I wanted to say something else about the healthcare thing. It's really important to communicate with your doctor. So be transparent. Don't hide things. Don't keep it a secret. If you have complaints, go to the doctor. Call your doctor. Call him until you have, until you feel like you have been heard. Because that's how they take it serious. If you don't talk about it, they wouldn't know. You know, so please call. If you're not feeling well, just call. You pay insurance, so call, and they will help you. And if you feel like you're not being heard, go to another doctor. Ask for a second opinion, because it's possible here in the Netherlands. You can ask for a second opinion.
Please, I have 2 questions. Because from your explanation, you say you can terminate the child when you find it, if it is in the body. Because on Friday, I saw the sister, she says they detect that she have it from the stomach of the mother's womb. And in case of globalization, is it wise, when you have seen how long the problem is going to affect the human body, to terminate it? Is it right? Number 1. 2, second question is, you are referring, I can reason that the cost of all this improvement can only be affected by the blood. I want to talk about that blood issue, because the blood is the main factor that we don't consider very, very important, because you say you can donate the blood, and when you donate the blood and you have sickle cell, and what is the benefit of donating the blood? Now they are saying that you can go there and have transplant of sperm to have a child. And people, I'm coming, and people are getting so nice on this. The donation of that blood, what is the significant effect if the doctors are requiring the people to give free will done of blood to the hospital? What is it for, please? Based on sickle cell patient not find tuberculosis, all this disease not find, but you can go there and donate it. What is the effect of it, please? Thank you.
Thank you.
Can I correct the first statement he said about the terminate one? I didn't hear that one. Anyone said it here. So nobody said in here about when you find that you have a child that do termination. We didn't say that in here. So please get that right. That has not been said in here. Who said that? No. Let's hold on, please. Let's not get us wrong. There is he says they give treats, and somebody let's use the blue and the red, and then what they explained to us on Friday here is you can have what the symptoms, you can have what the treat. The parents will know. It's up to the parents' decision to say we will take the risk and we will still have a child, or we don't take a risk and we'll have a child. That is what we said in here. Yes, we did not say in here that what you go and have a child, and once you have the child, then you are going to test. Do the child have it or not, and then make a decision? No. You already know if the man and the woman, based on the treat already. There you already know. So we are not going on our... So we need to be very careful in here. It's a health awareness. It's not a moral issue we are talking about in here. And what you are bringing in, you are taking us to a different level. That is not where we are going. Yeah, we want to just, I think Pastor Joel just said it, information, they are giving us the information. The application is up to each and every one. They did not say, and I make sure, none of the doctors said in here, or none of the experts said in here that what, once you have a child, or once you are conceived, and you know that the child is a potential of a sickle cell, you terminate it. No, we don't have right to say that. Okay.
Yeah, I think the answer to that question was that we said for the white people, they actually seek knowledge about this kind of things before they take a step. And I think Dickness Yolanda also made a statement that Dickness Yolanda also made a statement that she has a friend who always asks before, as soon as she meets someone, she asks, what's your black group and stuff like that, your medical background. But here lies the case, we blacks, we don't ask. As soon as we meet, we love each other, blah, 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 we just enter, start doing, yeah. So it's rampant. And I think Pastor Byron also made an example with, is it Parkinson or something like that?
Yeah, Parkinson.
Yeah, also being common among white people than black people, yeah. So that question was pretty much answered last Friday.
Thank you.
Hi, ik heb een vraag. Ik denk dat heel veel mensen naar deze conferentie of naar deze dag naar de huisarts gaan om het bloed te testen. Zit het in je zorgverzekering of moet je naar een ander pakket kijken?
Insurance.
Ja, goede
Oh yeah,
vraag.
so basically let me translate the question and then give it on to Deacons Yolanda. A lot of people will, after this health awareness program, approach their GP, their physician, and request a blood examine, and then try to find out if they have the sickle cell or not. Is this covered in the insurance you are paying monthly or not? I think assuming that you have the basic package, I think. Eh?
I wouldn't know, to be honest. I don't know if it's in de basispakket. Wilde je wat zeggen, Nathaniel?
Kijk, van huisarts, if you're going to the general practitioner, I don't know, but I've experienced when women are already pregnant and are going to the verloskundige. Usually when they ask you, like, they take your blood already and you have the choice to maybe do the nip test or the flocker test or the other test. Usually get the chance to also do the test for sickle cell. And that usually is covered. But for the general practitioner, I don't know.
Yeah, so that's usually when you're pregnant. They do some steps, they do some research because of the pregnancy. But I don't know if you go now, if they would, if it's covered. Met de basis? No? Okay, I heard it's not.
You said in here, those that are born in here at a young age already, there is that test.
Hielprik.
So if you are born in here, it should be in your archive. It should be in your file, whether you are a carrier or not. I'm thinking. Am I wrong? So the young ones, the record should already be there.
So,
we that were born from somewhere, we are okay. we are okay. But those who are born in here, the record should be there.
Basically, Pastor Butterbeck is saying, due to the fact that from a very young age in the Netherlands, it is structured like so that they will do an exam to determine if you have it or not. And in case you have it, they will 100% alert you that, you know, we discovered this in your blood, and it will be in your medical archives or medical records. Please.
Okay, that's what I want to ask, because if your mother they get the baby, and you went to the outside or even the hospital, and they have to check you. Why this mic? And they have to check you before you were born. Then automatically, like you said, your things are there already. So if like you want to get a partner, you can Just go and call your name. They play quack, 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 quack. Then they will see your particulars there. So there's no need like making it a constant that I have to take my partner to the doctor, blah, 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 blah. So if you have your girlfriend, so today let's go to where they give you birth, you know there. So if you go, they can go and put the thing back, simple. For we where we come from there, we will know how to check all these things. We will get it one touch. You see, do you know have time to go and check. Thank you.
Yeah, and because of that, and that's the thing, because you guys didn't check, a lot of us have sickle cell now, so...
Hey, please.
Yeah, echt hoor. Yeah, I'm being very honest. Yeah.
What do you say? Come again.
I didn't say anything.
No, you say because we don't check, that's why.
Yeah, because you guys went quack, 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 and then...
No,
yeah.
you see, those of us who are born from Africa,
yeah, I know.
We are strong. See,
yeah.
If you see your father, you see how strong he is. You see, we are strong because we eat good. I don't know whether the sickle cell is from what you eat or the blood or something. Yeah. Thank you very much.
Thank you
Elder
too.
Jim. Thank you. We have a question upstairs. Please, our deacon.
Revival. So
now,
we were speaking about the blood transfusion. From what age actually does the child is possible for that to happen? Is it when the treatment or when the symptoms get worsen and worsen, or is there a certain age where that child is being, compatible to get to that treatment?
Or at what age is it most effective?
Yeah, that's my question.
It depends on the condition. It depends on the person. So when you're young, when you're a baby, they can give you a blood transfusion also. But it really depends on the condition and the severity of the crisis.
Yeah, and as Nira also mentioned, she had a friend, and they are both carriers of sickle cell. Nira got the invitation or the green light from the specialist to proceed with the treatment, but her friend didn't. So, in this case, apparently, according to the specialists or the medical professionals, she has not reached a point of severity or whatever reason for her to start the treatment, if it is BMT or stem cell. But Nira actually got the green light. So that's why I also said there's not just a case of you selecting, or choosing, I'm going to start the treatment now. You really need the green light from your specialist or your doctor. No more questions? No remarks? Yes, we have one.
I had a question on Friday, and it's still the same question. Like, what is the root of sickle cell?
What is the
root cause?
Oh,
so where does sickle cell come from?
Yes, so we have not been able to find that. We have been able to find or understand why it is contained within people with a brown skin color. According to the information, that our cells are much, they can mutate more easily. And because they mutate, they can also change in shape, in form, in consistency, in construction, in comparison to Caucasian people. But the question was, I remember this question very good, what is it that brought it in the black community, or let's say the people with brown skin color, but it's not only the black community. And now we understand what contains it there. But what brought it in, what introduced it, big question mark.
When you asked the question, I did a little research. I didn't have time, but I searched something. But it said it started in Middle East Asia and Africa. That's where it started from. And it's a default in the body. But that's the only thing I could find. So maybe I should do more research, but I will get to it. And we have Sister Mahita Bell. She's going to do a research on it. So when she gets the information, she would share it with us.
We are going somewhere. We are going somewhere. Are there any other questions, remarks, things you want to ask, things that are unclear, things that we can possibly clarify? Yes, we have one over there. Mommy, please.
You said we should check. That's fine, but I want to know the symptoms because you only talk about pain. I think that's what I heard.
Yeah.
So I want to know the symptoms.
Yes, I can mention the symptoms, no problems. Like I said, it is extreme cases of pain, which will be caused, how do you say, acute. It appears out of nowhere, and it can start in one specific part of the body, like your arm, and then it starts to expand to your chest, to other parts. So pain is definitely one. Sudden pain, acute pain. Number two, tiredness. Because there is a lack of oxygen flow to different parts of the body, you will feel tired. And it is not because you have not rested well, but as a young person, especially as a young person, you feel that you're tired all the times. Three, shortness of breath. So you are young, healthy, or you don't have any underlying problems. You can have any age, but something simple like 2 or 3 staircases will finish you. And something that also Nira mentioned is that when she has one of the attacks, she sits here, there's enough oxygen for us all, but she feels like there's not enough oxygen for her to breathe. While you and me are just cool and collected. So the way they perceive it is a shortage of breath. You cannot take in sufficient oxygen through the lungs and through your aerial systems. So,
what he just explained could also be heart failure. So if you have symptoms, just go to your GP. If your body is not as usual, just go to your GP because you know your body the best, is what I always say. So if you feel some type of way, just go and have it researched. And yeah.
And give birth to a child and that not have, that is sickle cells.
And the other partner has it or hasn't?
No, one have it, one is carrier, but the other doesn't have it.
Individual case. So one is a carrier of the trait or the anemia? Red or red-blue? Red-blue. So one is red-blue and the other one is blue. And then the child, what is the outcome of the child? So one is blue, one is red-blue, and then what is the outcome of the child?
One is blue, and one is red-blue. Then you can't have red, because you have two blue.
So you can never have red, but you can also
you
not
have
have
red and blue.
So it's in the
It's
middle.
een beetje mathematics, maar... Echt serieus, ja. Ja, dus je moet allebei drager zijn voor een kind om ook drager te zijn of de disease te hebben.
Please, upstairs there's also a question.
Hello.
Yes.
Praise the Lord.
Amen.
Yes. During your presentation, when you were talking about the treatment, you mentioned about bone marrow transplant. You made mention of chemotherapy and radiotherapy. I misunderstood that section. Could you please?
It is basically that is not the main treatment, but often you see that when someone experiences a BMT, bone marrow transplant, the specialists who are responsible for that treatment can opt to, in addition, also do chemotherapy in combination with the bone marrow transplant or do radiation, depending on what is more suitable for the patient at that moment. But that is not the main treatment.
The reason why they add chemo or radiotherapy is an unusual cell or blood is entering your body. So when you're sick, your body fights it. So automatically your body will fight the transplant. So that was what the thing that they put in your body. So the chemo or radiotherapy kills everything so that your own blood cell wouldn't fight the new ones. So that's why they give like radiotherapy or chemotherapy, so that your own blood cells wouldn't fight the new ones that enter.
It's basically like a reset.
Yeah, basically, because it can be that it will fight it, and then the treatment is useless.
Revival.
Now.
I have a question. Can you go from sickle cell trait to sickle cell anemia? Anemia.
The same person.
Yeah, yes.
This one is other person.
Please. Yes, please.
That is not possible. No.
Oh, okay.
On
Thank
the
you.
left, yes.
Can someone with a red blue ask for a treatment not to have the red?
Someone with red blue?
Yes. So if you have the sickle cell trait, can you ask for a treatment so you don't have a trait?
No.
It's not. Okay.
No.
Because you don't have the symptoms. So usually in Nederland, when you have symptoms, then they treat it. So if it's not necessary, they won't treat it.
And you won't even know if it is effective because you don't have symptoms. So there's nothing to combat. So if they do the treatment, they won't know if it had effect or not, because the symptoms are not even there. And like Yolanda said, it is also part of the, you could say, the medical culture here. It is that they
We don't have symptoms. They usually just leave it.
Yeah.
Sorry, I have another question, please. Is it okay for a Christian to donate?
Is it okay for?
A Christian to donate.
Pastor Waterberg.
Yeah, this is.
Blood.
Is it okay for a Christian to donate blood?
Yes, please.
Do you like it? Somebody said many questions coming. That is what I mean by moral questions, and we are here for awareness, not moral topics. Yeah? So we can give an answer, and then a second question just came in here. So I don't want to even take the second question or this one at all.
So it would be wise then to, approach you in the office.
That is also possible. What he said, after service, if you want an answer, of course, you can also approach us. Yeah? Thank you.
No questions? Okay, that's it. After the service, we have the free health check. We're going to check your blood pressure, your blood sugar, and the oxygen in your blood. So feel free to come on the first floor. And if you have other questions you want to ask privately, you could come as well. And we're still searching for people for the medical team. So if you're interested, please come to me, and then we'll have a chat.
You have been a wonderful audience, and a big applause for yourself. Thank you for listening, paying attention, and we thank God for the opportunity we had to share this with the church. Like I said, it is also good to share knowledge on the medical field, because things can happen among us, and it is wise to know how to deal with it. It is wise to know what to do in certain situations. And we're already planning for the next health awareness, so this will not be the last you will hear from Pentecost Revival Medical Team. Thank you so much.